also think it's important. We also think it's important for people to get a break. And so we have staffed up with traveler staff so that the people who've stuck with us throughout this long ordeal have a chance to take vacation and get some respite. As I talk with my colleagues across the state and locally, just about all of the hospitals are at or near capacity, and certainly all of the tertiary care hospitals are full and unable to take additional transfers. Next slide, please, Shamara. The problem for us in Western Mass is that Hampden County has the lowest rate of vaccination in the entire state. State of Massachusetts, in terms of the percent of population fully vaccinated, is about 66%. But for Hampden County, that number is a low 52%. And it means that the amount of COVID we're seeing is disproportionate here. As of yesterday, there were about 600 patients, 600 inpatients across the state, meaning that Bay State had 16% of all the inpatient COVID patients across the state, with only 5.5% of the inpatient beds. So that's 3 times more than what you would have expected if cases were distributed evenly. We have attempted to educate the public, and along with our colleagues at Mercy and our public health authorities have really been pushing out the information, making vaccine easily available. And I'm thankful to many members of the business community who have been excellent partners in this regard. We've been trying to influence the influencers to debunk some of the misinformation that's out there on social media, and to have pop-up clinics or mobile vaccine presences all across our region. Next slide, please, Romero. Our response to the crisis, some of it is the same and some of it is different. We have stood up our incident command team, which meets every day to coordinate our response. We are administering the so-called monoclonal antibody. This is the same product that former President Trump received that took the edge off of his illness. We're administering about a dozen doses a day to patients, and this will make it less likely that a person will be ending up in the hospital. We also have a COVID at home program so that patients can receive high flow oxygen, and so therefore that often shaves the last few days off of an inpatient stay. As we have been doing since last summer, we continue to use antiviral drugs, anti-inflammatories, and special approaches to administering oxygen that help avoid the use of a ventilator, which often prolongs a patient's stay. And I mentioned we have the mobile vaccine van, which has got a schedule now of 1 or 2 stops pretty much every day for the next 2 months. In terms of managing the crush of patients that are coming to the emergency room, we do try to do load balancing with our 3 community hospitals, but they are pretty much full at this point. We have added additional personnel to expedite discharges, so there are no delays of an administrative nature to get people either home or to the next stop in their care plan. There is an ED fast track, emergency department fast track, so that people with minor illnesses can be treated quickly and sent home. We've even taken a look at becoming more strict about what kinds of transfers we accept, particularly from Southern Vermont, Northern Connecticut, and Berkshire County. We really want to make sure that these are people who are going to be helped by our intervention. We've started to have conversations around various elective procedures, and every day I've got senior leaders, the presidents of the hospitals, our chief operating officer, huddling to swing resources and add additional resources to keep things moving. Next slide. I don't need to remind most of you that there are certain things that Bay State Health does for which we are the only provider in all of Western Mass, the only place for level 1 trauma care, the only place for a neonatal ICU, only place for cardiac surgery or for the various vascular interventions that will open up an artery for a patient with a severe stroke or heart attack, the only place for specialty peds, including a PD ICU and PD emergency department, specialty cancer services, high-risk obstetrics, the list goes on and on. And it's important to remember that for some of these problems like trauma or heart attack or high-risk OB, delays and having a person leave the area actually results in a worse outcome. So when we get to the point where we are unable to keep our doors open for people needing these services, I get very worried. And what prompted my call to Rick, excuse me, was during the weekend of Hurricane Henri, we, because of the weather, we were unable to get patients discharged expeditiously, and it led to serious backups to the point where we were even considering telling ambulances that they couldn't come, that we couldn't take any more patients, and therefore would have had to gone to Hartford, Worcester, Boston, and we know those hospitals are pretty darn full as well. So it was a pretty scary moment. We were able to manage our way around it, but I certainly don't want to be seeing any more COVID that would put in peril all of those other non-COVID approaches to care, particularly when the COVID situation is entirely preventable. Next slide. So our ask today of the business community is really to help preserve some of these vital services. Bay State Health is a community asset. Our Springfield campus has been around for 140 years, and we're owned by our community and really feel it's important to serve the community. And I think that if we can work together as a community, those of you who are in influential positions can help us to lower the demand for our services, lower the rates of COVID. The two big asks are to consider an indoor mask mandate. We're talking not only with our business leaders, but also with the local boards of health and civic leaders to try to develop some town-by-town mandates. And we're beginning to get some good traction there. And also to do what you can to promote vaccination. Obviously, there's an escalating approach to this. First step, of course, is to make it easy, make it available, to make sure that people who want to be vaccinated can get time off from their duties, to make it very convenient for them. People need support, not only information for the questions or to debunk misinformation, but certain people are just plain scared of needles and need somebody to be there with them and tell them that it's going to be okay. A variety of incentives have been tried by other large corporations, either cash bonuses, linking retention bonuses to vaccination status, putting surcharges on health insurance. I know some national companies have tried that. And as you know, certain sectors, home care, nursing home, hospitals, have actually stepped up and mandated it and made it a condition of employment, except for rare cases of religious or medical exemption, which I'm sure Attorney Kennedy is going to be getting into. So that's our ask for you. We would appreciate any of your thoughts about this. And I think at this point, Jomara, I am going to hand it back to you so you can introduce Dr. Roos. We want to be here for you, so please help us.
Thank you so much, Dr. Kerouac. That was incredible information. And I can't stress enough to our audience as well, the importance of working together and really being able to get through this. So at this time, we're going to now introduce Dr. Roos from Mercy Medical Center, who's going to go in deeper depth about this information. And I will give the floor to Dr. Roos.
Thank you. And I want to thank the Western Mass Economic Development Council for hosting this special meeting, and also Dr. Kerouac as well, who has been a leader throughout the entire pandemic. And you will hear some information from me that provides some perhaps additional context and some perspective on behalf of Mercy Medical Center. But you'll also note that we have been aligned as health systems in this region, all throughout this pandemic, and very appreciative for the support and the level of care that Bay State Health provides in our community and the collaboration that we've enjoyed to help us combat this pandemic. I want to recognize, you can stay on that first slide just for a moment. I want to recognize that, we see these simple graphics here, and I'll provide some updates. But I also want to recognize this is a moment for us, if we look at that middle picture, and not just us in healthcare, but us, I think, in the entire community, and particularly in your areas of business as well, that we are in a moment of exhaustion. This is, I think, now has surpassed what we would call pandemic fatigue. In many cases, people and businesses have either been pushed to the brink or beyond. We've seen trauma, we've seen grief, we've seen loss, not only of life, but of livelihoods, of businesses, of various aspects of our society. And this has become something that's so large that it's its own thing, but it's also become sort of part of everything. As you can see that picture on the left there, as we've all navigated in sometimes bewildering ways through the last 20 months. Yet that being said, it's also a time, when with challenges can come significant opportunities for strength, and also through resilience, we can sprout some new growth. And that's really, where I come from in my perspective to highlight some of the ways that this has changed us, and some ways that we can reinforce that so we can continue to grow stronger together. You can go to the next slide. I want to recognize that this is a very hard moment for us. We are dealing with the fourth surge, as Mark mentioned. The magnitude of these surges is different, of course, at our various hospitals. At Mercy, our experience has been similar, right-sized to the scope of our services and our facility. Now, a full 18 months since we began this pandemic, we are seeing that rise, as you can note there, in hospitalized cases that is surpassing, if the trend continues, where we were back in March and April of this year. And if we aren't careful, could continue to climb, likely not to the rates of where we were 18 months ago or in January of this year, but certainly to a degree that is straining our system significantly. Even after all of the lessons learned, all of the scientific advances, all of the vaccines, we're seeing, of course, with some resistance, with the new strains and variants, and the amount of vulnerable people that still exist in our community, a concern regarding rising hospitalization rates. As of this morning, we have 14 patients at Mercy. One is in critical care, but 14 in our hospital represents about 15% of our total census, which is rates very similar to where we were several months ago. Our test positivity rate has climbed with tests done through the hospital at over 6.5%, which is significant. And I'm going to talk a little bit more about what that's been done to our hospital and our system as well. Next slide. I do want to tie it together for a moment that what we're experiencing here locally is still very much influenced by what's happening across the globe and what's happening across the country. This remains a global and domestic pandemic that's impacted all sectors of our society, right? It's obvious that this has impacted people's health. The acute illnesses that come from COVID, many of us have known, if not all of us, people that have either been infected or suffered the tragedy of loss related to COVID. But we're also learning more about and understanding the risks of having a COVID infection that could create lingering or long-term symptoms or risks as it impacts the blood vessels in the body. Also risks related to pregnancy in women in particular and their newborns who may have acquired COVID during pregnancy. We've also seen, as Mark mentioned, an increase in the demand for services for patients struggling with behavioral health conditions. That has been linked to not only the pandemic and its impact, but also some of our responses to the pandemic, seeing increases in depression, anxiety, and alcohol use. And this group knows as intimately as anyone the impacts on our economy in terms of businesses, lost revenue, unemployment, significant changes in how we operate, as well as the social impacts that can have on communities, towns, and cities. We're still understanding, I think, the scope of how the pandemic has impacted the education of our children, but certainly we know that it has been significant, as well as disrupting our lives in the ways that we engage in our communities and families. These trends across the globe and country, although you might see there that they have started to plateau or even dip a little bit, I want to stress are not in any shape or form a place of comfort for me. We look at the rates, 222 million infections across the globe, and there's still over 600,000 per day. In the United States, it's over 150,000 per day, and we're back at having 1,500 people die every day across the country from COVID. Next slide. In Massachusetts, you may be familiar with the daily dashboards, and our rates have been tempered a little bit by what has been a relatively higher vaccination rate amongst the entire population here in Massachusetts compared to some other states. But nevertheless, we've seen that rise in cases climb to over 1,100. Our test positivity rate's been over 2% and has been plateauing for some time. And although the death rate has remained in the single digits, which is a testament to advances, as scientific advances in treatment and therapeutic changes, as well as vaccination, hospitalizations, as have been mentioned, has started to increase and has crossed over 600. And we are disproportionately feeling that impact here in Western Massachusetts compared to other areas of the state. And we can see that on the next slide. If we look specifically at the rate of new infections by county in Massachusetts, if we take out Dukes and Nantucket counties, which of course have very small populations, Hampden County, unfortunately, is leading the way with the highest daily rate of new infections per 100,000 individuals at 33.9, which is about 50% higher than the next closest county, which would be at 23.6. So we are leading that by some margin. And if you look specifically at Hampden and Hampshire counties and just looking at the darker shaded towns and cities as having higher rates, you can see that Springfield, Palmer, Granville, but many of the surrounding towns remain with significant daily incidence rates. So we are seeing the prevalence of that increase. And I know the city of Springfield has seen the rates of infection go up, I believe, in 9 consecutive weeks. So we are very much amidst this fourth surge. The next slide. So why are we seeing this surge now? And we are seeing it predominantly due to what has emerged over the past many months as the predominant strain, the Delta variant, which we've all heard about, which is responsible for essentially all of the new infections across the country. It's well over 94%. It's probably approaching more like 98 or 99%. And this was predicted by the CDC many months ago. If we didn't increase the vaccination rate quick enough, we knew that this variant was going to spread very quickly because it is more infectious than the prior strains, including the Alpha variant. This strain was first identified in India and has since spread across the globe as the predominant strain. And it's about twice as likely to infect individuals than the original Alpha strain. That's the R0, the number of people that one sick person would infect sort of under circumstances where people are all vulnerable. We've also seen some evidence to suggest that this could be a more severe variant in that it leads to more severe cases needing hospitalization relative to prior or the original strain. And we know that unvaccinated individuals are of greatest concern to experience those significant effects. Although we know that vaccinated individuals can acquire COVID and they can transmit it, and they can have significant viral loads. There is some evidence to suggest that it may mitigate, particularly for older individuals, those that are at most risk, the most severe of complications. So vaccination remains an important strategy. But over this, and also relevant, over the last 6 to 8 weeks, the CDC just published a report that we're now starting to see an increase in hospitalizations amongst children and adolescents. Not necessarily meaning that the Delta variants are more severe for those cases, but what we are seeing across the country is that there are more kids and adolescents being infected. And so as the more infectious variant has spread to a population under 12 that is not yet vaccinated, accordingly, we're seeing more infections, and therefore it's leading to more hospitalizations, which is of note and of concern. Next slide. At a high level, I want to just visually show some of the science behind the effectiveness of vaccinations. There is a lot of individual studies that are showing the effect of vaccines in particular, but at a high level, if you look at the two maps and compare the areas on the left where there are the highest rates of current hospitalizations, in the darkest colors, the deepest red in Florida and along the Gulf Coast, those are also the areas and you can pinpoint it almost down to the counties that have had the lowest rates of overall vaccination uptake and acceptance. areas in the Northeast, some areas in the northern Midwest, where the heat map on the right of the vaccination rates of those over the age of 12 are a bit darker, have seen less hospitalizations and less cases overall. There are, of course, some states where we don't have the data. Those are the ones that are sort of whited or grayed out, but you can see that trend just at a very high level, which has borne itself out over the last several months. Next slide. Yet I would caution us, and Dr. Kerouac mentioned this as well, there are still significant disparities that remain in terms of who is vaccinated that leaves members of our community right here, particularly in Hampden County and Hampshire County, very vulnerable. The map of Massachusetts on the left shows the percentage of individuals of all ages, so including children, that have received one dose of a vaccine. And you can see that Hampden County, unfortunately, is the county with the lowest vaccination rate at just 58% all in with one dose. Hampshire County, not too far behind at 65%, where there are some counties that have pushed that over 70. In the map on the right, looking at those that are eligible, so individuals over the age of 12 that have been fully vaccinated, you know, the rate is a little bit higher because we're only taking into account those over 12, but Hampden County and Hampshire County still are quite a ways behind some other areas, and it has left us particularly vulnerable. And it has not been, vaccination rates have not been distributed equally. And if you look particularly at the bottom, Hampden County, you can see there is a disparity in terms of the percentages of individuals who are vaccinated along race and ethnic lines, with Black, Hispanic, and multiracial individuals in Hampden County having a far lower rate of vaccine acceptance or rate of vaccination compared to those that are Asian or white or Pacific Islanders. And so there are significant pockets and areas in the majority of our community that remains unvaccinated and therefore vulnerable to the severe impacts of COVID. Next slide. And so the issue really is that while vaccination rates are varying and there are disparities in those, and we have very significant pockets still of vulnerable individuals, and we're also addressing the fact that at some point vaccines may wane in their effectiveness, and there's some ongoing debate about the availability in the near future or the evidence for in the near future additional booster doses. And that's something that's still not yet determined, but certainly on people's minds. It reinforces the importance of going back to basics in terms of public health strategies. And masking is really the key strategy. If we look at all of them, masking is really the key strategy that has helped prevent infections and help us return to normalcy and decrease and contain this virus and contain these surges. And there's a few reasons why that is. First of all, not everybody's vaccinated, as we know, particularly children who are not yet eligible and can spread the illness. Secondly, vaccinations, while they're effective and beneficial, are not a panacea, which we know there are breakthrough infections. We are seeing some hospitalized patients, and we've certainly seen infections amongst our colleagues who have been vaccinated for some time, as well as patients. The hospitalizations are largely driven by advanced age and underlying comorbid illnesses if they were vaccinated, but it's not 100% effective, as we know. And the Delta variant particularly has been of some concern, as the vaccines may not have been quite as effective with the Delta variant as prior variants. And then thirdly, I want to highlight that masking has been consistently and across many studies and countries shown to be quite effective in reducing risk of transmission. And if you look at that graph in a simple way, if you move to the right on the bottom axis, where we're looking at the effectiveness of masks, and you go up the axis in the vertical way where we look at community level of adherence to masks, it dramatically reduces the rate of transmission so that it can go from a significant transmission to somewhere it's actually the R0 is less than 1, meaning that less than 1 person would get infected from a sick person, and therefore the disease would start to shrink over time as opposed to expand in the community. And this has been repeated in many studies time and time again, that masking is quite effective when it's utilized appropriately and universally in settings. And that's why the CDC several months ago did revise its mask recommendations, even for those that are vaccinated indoors in areas of substantial or high transmission. And if you look at the map of Massachusetts as of yesterday, all of the counties that are in orange or red, so as every county except Franklin, is a county where we would consider it to be of substantial or high risk of transmission. Next slide. So here we are, right, in the fourth surge. We've been dealing with this for some time, our local area amidst the pandemic, and our rates are going up. So this is a call to action and a discussion based on evidence to see what we can do to improve the trajectory of this virus in our community going forward. Next slide. I do want to highlight, just as Dr. Kerouac did, the impact on our health system is significant. Our health systems, our hospitals are not invincible. We are well prepared, and we have been since the beginning of the pandemic, to deal with public health emerging threats. But this pandemic has taken, I think, an unprecedented toll on our hospitals, and Mercy is notwithstanding. You know, on a positive note, there's been many things that have happened that have stimulated some redesign in terms of operations, you know, expansion of telemedicine, for example, our attention to infection prevention and reinforcement of what keeps people safe when they come to hospitals for care. But this has come at a grave financial impact with excessive and significant expenses and costs that have come at the return of no revenue. As we've changed entrances and increased our staffing to do things like temperature checks and various other things. It's also come with a decrease in overall volume and an increase in staffing costs as the labor markets have completely changed. And so we've essentially been extorted to be able to bring in traveler agency staff from other areas. And we've seen an incredible drain on our resources from a staffing perspective related to the exhaustion, fatigue, the concern for one's safety, the direct loss of life or illness that's come from this pandemic, and many people exiting due to retirement or relocation or moving into other fields as a result of this. This is now a daily challenge, as was mentioned before, where our hospitals are significantly, generally speaking, at capacity on a daily basis. We're looking for, we have vacancies in our staff that can approach 20% when factoring in medical leaves and other time off, in addition to those open positions. And it's led to challenges for patients getting the right care in the right place, where there have been staffing shortages in skilled nursing facilities, so patients can't transfer out of the hospital at the right time, and emergency departments that are overwhelmed with patients, as there are patients waiting for inpatient beds, and there's been an influx of patients seeking care in ERs, as opposed to perhaps other care like primary care offices and urgent care. That has put an incredible strain on hospitals that had started many months ago, and it only unfortunately has worsened. And the concern is that the staffing challenge really could be one that lasts for, if not years, potentially an entire, partial or generation of staff, as they've really seen the impact of a devastating crisis. Next slide. At Mercy, we have done a number of different things to address these issues and to support our staff. And just to highlight them just visually for a few, we have started to really think differently in the ways that I know many of you have in your businesses, with new processes. We've implemented in the top left corner Kaizen events, so lean processing to think about how to continuously improve what we do to be the most efficient and effective. We have developed ways of operating that have contributed to us ensuring that we provide safe care without clusters of outbreaks, to ensure that our patients are cared for without excessive risk, and to be able to deliver the highest quality outcomes, which are reflected in many of the publicly reported scores. We've also made treatment advances, opened up vaccine clinics and provided vaccinations to our community, and also implemented a vaccination mandate. For Trinity Health's case, this was a mandate that was implemented across the entire country, all 90+ hospitals and facilities across the United States, with a timeline that is rapidly approaching as September 21st, where all colleagues and medical staff, with only a few minimal exemptions for medical and religious reasons, will be vaccinated to be able to, as a condition of employment and providing care within our facilities. And lastly, I want to highlight, the resiliency work that we've done with teams you can go back a little bit, with teams to mobilize areas of distress where we've allowed people to work flexibly remotely, where we've had supportive HR practices, provided time off related to COVID, carry over PTO banks from year to year. And it's important for us to be able to celebrate some of those successes. So as we move forward, from Mercy Medical Center and Trinity Health, I believe the time is now. It's been the time for 18 months, but it continues to be the time now, again, for us to offer significant interventions and recommendations. And so what we can do together is really ensure that we support our colleagues, support our caregivers, and support our community. That could be through programs. It could be through direct support. It could be thinking ahead strategically and innovatively about how do we build the workforce together. It's recognizing that we're all connected. The success of our hospitals is contingent upon and related to the success of our businesses, and vice versa. And the community is all connected to each other in terms of health and safety and livelihoods. Reinforcing the public health practices are key. And so I would support indoor mask mandates, particularly in cities and towns where the rates of infection are high, and think we all should be considering that. In healthcare, it's been the law of the land since the very beginning, and I don't anticipate that changing, and could see masking living on even beyond COVID in hospitals where there are vulnerable people, and we can just see how effective this intervention is to reduce the rates of all sorts of respiratory infections, COVID included. I would also reinforce the recommendations that vaccinations are critical, and so anything we can do to increase acceptance by making them available, considering mandates within your businesses as employers, that together, if we are able to reinforce and accentuate these principles, that we will again come out of this stronger. Thank you for the time, and I'd be happy to be part of the panel later, and I'll pass it back to Xiomara.
Thank you so much, Dr. Roos. Really reinforcing the importance of working together and considering all of these different mandates to help our communities, persist and do and overcome this pandemic. So now I want to switch gears over to attorney Mary Jo Kennedy, who's here with us today to really talk more about the HR sector and some of the legality around vaccine mandates, et cetera. So I'm going to give the floor over to Mary Jo. Thank you very much for being here.
Thank you, Xiomara. I appreciate it. And I also would like to thank Rick Sullivan and the Economic Development Council for asking me to speak on this very important issue. So if you could just switch slides here. All right. So we've been talking about this issue in the legal community about mandatory vaccines since even before vaccines were available. The EEOC, which is the Equal Employment Opportunity Commission, which is a federal agency that enforces the discrimination laws, issued back in December of 2020 some guidance through frequently asked questions that provided some guidance for employers on whether in considering mandatory vaccines. And that guidance indicated that employers could require mandatory vaccines. So since December, employers have been thinking this issue and looking at considerations of whether to mandate vaccines or not. And you can see in this list, the first three that are highlighted in red are really now no longer an issue. Vaccines are readily available, so that's not a concern about having a mandatory vaccine policy. I think, as we've just heard from Dr. Kerouac and Dr. Roos, the efficacy and effectiveness of vaccines has been proven, and so that is no longer an issue. And now, with at least one vaccine receiving full FDA approval, vaccines being only authorized with the emergency use authorization, which requires the consent of the individual to have the vaccine, that no longer is an issue as well. But the last three are more subjective issues that employers have to look at. There's a concern that you're going to lose valued employees because they have a philosophical, again, they have a philosophy against having vaccines, or it's just the culture of the organization that's just not something that organization does in enforcing things on their employees. And I think the most concern was the risk of lawsuits in mandating a vaccine. If you want to go to the next slide. So in addition to the EEOC giving us some guidance on vaccines, OSHA has also provided some guidance, but I have to say that they have lagged behind during this whole pandemic on giving guidance and essentially are just following what the CDC is recommending. But we did get some interesting on this issue of mandatory vaccine policies. We did get some interesting guidance from the OSHA that just came out in August. And that they changed their language in their guidance. And again, it is only a guidance. It is not it's not mandatory. It's just a recommendation. They changed from what they written in June that they issued, from really focusing on strongly encouraging vaccinations among workers and facilitating employees' efforts to become vaccinated, to changing that to employer now considering adopting policies that require workers to be vaccinated. So they're focusing on that, strongly encouraging, which is, I think, what a lot of employers have been doing throughout the spring and summer once vaccines were readily available, to really say, okay, let's consider these policies. They also, if you want to go to the next slide, please, had some more minor things on that, which again are just adopting what the CDC is recommending, that even for fully vaccinated individuals, they should, in public indoor settings of areas of substantial or high transmission of the virus, that they should wear masks. And the only other thing that the OSHA did, was that there's a recording requirement when you have for work-related injuries, and that they are not enforcing through May of 2022 an employer's requirement to record workers' side effects from COVID-19 vaccines. So again, they did that, and the OSHA specifically states that they're doing that because they do not want to discourage workers from getting vaccinated, and they do not want to disincentivize employers' vaccination efforts. So that's what the efforts that OSHA has done regarding recommending mandatory vaccine policies. So we've heard from Dr. Kerouac, we've heard from Dr. Roos. As employers, we have been kicking this issue around for months now. So I think from what we've heard from them, if you're waiting for a sign, this is it. I found this sign during COVID, and it's been relevant, I think, in a lot of issues, but I think this is really relevant in this issue. It's time now for employers to really not just consider it, but really take some affirmative steps in developing a mandatory vaccine policy. So what does that policy need to talk about? As part of the policy, you have to collect proof of vaccination. And back in 2020, in December, the EEOC already said that employers can keep and can request from employees information about whether they're vaccinated and can collect proof of vaccination. Now, employers must, when they do that, keep that confidential. It's not confidential under HIPAA, but it is confidential under the American with Disabilities Act's confidentiality provisions, that information must be kept confidential. And you have to avoid, as an employer, disclosing it, an individual's vaccination status beyond the people that need to know. And in addition, when you're asking for proof of vaccination or information on whether someone's vaccinated, you have to be careful as an employer not to elicit other medical information from that employee, because that is something that you should not be doing. As Dr. Kerouac referenced, that if you do have a mandatory vaccine policy, that doesn't mean everyone has to be vaccinated. There are exemptions for individuals who have a disability or sincerely held religious belief that prevents them from being vaccinated. Now, this is, some employers may be very familiar with this in just dealing with accommodations for individuals who have a medical condition and need an accommodation at work in order to do their job, and that you may have a robust HR department that's being able to handle this. But many employers may not have that have that robust department in HR to be able to deal with all of the accommodation requests that will come in. And they have to be dealt with on a case-by-case basis, depending on the condition the person has and depending on the type of job that person has. So it requires an individual assessment of whether you're able to provide a reasonable accommodation to that person. And just I'm going to go back really quickly. I know I'm running out of some time here, but just to talk, if you go back to the other slide, on sincerely held religious beliefs, you really need to, as an employer, accept whether someone's belief is sincerely held. You shouldn't be questioning it at this time. And you should also request both of these information in request forms in writing, so then the employee provides that information on that. Okay, the next slide. The other issue you have to deal with is if you have union employees. If you have them, you have to most likely negotiate with your union any mandatory vaccine policy. So you need to create a policy, then work with your union on it if you have union employees, and then also roll it out to your non-union employees. The other consideration you have to look at is what's the consequences for not complying. Some policies are being written, and some employers are enforcing it as, that if you don't meet an exemption and you're not willing to be vaccinated, that's the end of your employment. Others are taking a less severe response to that. Some are saying we're going to put you on an unpaid leave for 30 days for you to rethink your decision. Others are saying, well, we're going to just require weekly COVID testing and limiting your access to certain areas of the workforce or the work area. That, again, is not as effective because the whole goal in a mandatory vaccine policy is to get people vaccinated. The other consideration that you have to look at in mandatory vaccine policies is that if you have non-exempt employees, that means hourly, you have hourly employees, that they may be required to be compensated if you're requiring them to have a COVID test. And that is something that the Department of Labor has come out with in its frequently asked questions. And in implementing a mandatory vaccine policy, that you should also consider that you need to give people time, 30 days, 60 days, they need to come to an understanding of, to get their arms around it, to be able to accept that this is now the time that they're going to get a vaccine. There could be a number of individuals. I think it was discussed that you might find that your workforce, that most people are going to be not having a religious or disability exemption, but that it's just a personal belief that's not a religious exemption, and that they just need to come to terms on that, and they need more time just getting them to get that vaccine. And you should continue to consider offering paid time off for people to get vaccinated, or if they have a reaction from the vaccine. Again, that's something that under state law now is required through September 30th under the state law, which ends at that time. But the goal is to get people vaccinated, and so that you want to get rid of any disincentive for them for not wanting to. They don't have time, or they're concerned that they're going to have a reaction on that. In any policy, you really should have a legal review of a mandatory vaccine policy because of all of the considerations that are involved here. And I'll send it back to you, Samara.
All right, thank you so much. We have a lot of questions that came through, so I'm going to stop my share for everyone, so you're going to see our main presenters. So again, thank you again to Dr. Kerouac, Dr. Roos, and Attorney Kennedy for all of the incredible information that you shared this morning. So let's kick it off with some questions. We have a lot of different ones from the group today, so thank you to the audience that have been submitting things and really reacting to everyone's talk this morning. So this first one is actually going to be for Dr. Kerouac. A specific question came up saying Florida set up a set up monoclonal clinics to lighten up the load for the emergency rooms. So is that something that Western Mass will consider, in your opinion?
Well, it's something we are currently doing. Currently, we are administering monoclonal antibody at Bay State Noble Hospital. It's been a booming business, unfortunately, for us. We've done, on average, about a dozen patients a day and as many as 18 in a day. So it is an important thing. Monoclonal antibody is something to consider if you are a high risk for being admitted. Chronic condition, obesity, diabetes, high blood pressure, older age, and you just learned you've got COVID. If by the time you're very sick, it's kind of too late. So if it's early on in the disease and you were a person who was in one of those high-risk groups, you certainly should be talking to your doctor about monoclonal antibody. But we're doing it right here today in Western Mass.
Thank you. Good to know. All right, so the next question, this actually might be for Attorney Kennedy. So if a reasonable accommodation is provided, can an employer mandate an individual with an accommodation to wear a mask when they're indoors or when they're driving another employee in a work vehicle?
Wearing a mask could be a reasonable accommodation, but I think, as we just heard from Dr. Kerouac and Dr. Rouse, that all employers now should reconsider having masks in their workplace, particularly when they're working with other people or in common areas of their office. So I think, yes, that can be a form of a reasonable accommodation, but I think that the medical experts would say it should actually be worn in the workplace.
And might I add to that? I don't know if the question was looking at it the opposite way, but we've had very, very, very rare exceptions where a reasonable accommodation would need to be made to not wear a mask for patients, for example, who are entering the facility. So I don't know if Attorney Kennedy, you had a comment on that.
Yes. We're seeing, it's interesting because we're seeing some accommodations early on during for not wearing a mask pre-vaccine. Those individuals then, if they could be accommodated by working remotely, we're seeing it more now like in a school setting where students are saying, coming back to school and saying that they have a medical condition or a sincerely held religious belief that they don't have to wear a mask. And those certainly the DESE, which is the state agency, accommodates medical exemptions for that, but there potentially could be religious exemptions as well in the workplace. That's a lot rarer, though.
Great, thank you. Another question for Dr. Kerouac. Since you just went through the mandate for vaccines at Bay State, what's some advice that you would give any business owner who is considering putting this mandate within their companies?
Yeah, we're not all the way through it yet. The deadline for getting fully vaccinated is October the 1st, and so every day we're working this problem. I think right off the bat you need to communicate why you're doing it in terms of the safety and efficacy of the vaccines, and also how it aligns with the mission or the vision of your organization. For us, keeping patients safe, it was a pretty easy communication. I think then, as Attorney Kennedy mentioned, you need to make it easy for patients, give them time off if they're either vaccinated or having side effects, maybe even do on-site vaccination clinics. I know that some folks have worked with the local pharmacies to get the presence of vaccine right there on the shop floor. Then you need a process to deal with the requests for medical and religious exemptions. As Attorney Kennedy mentioned, many of them are questionable, and I think that there needs to be a process by which you ascertain which ones are legit and which ones are not. There also needs to be a process of logging in who's vaccinated and who's not, and particularly since folks may do this on their own out at a local pharmacy. And then you need to plan for contingencies. I think we are working those numbers, and it wouldn't surprise me if we had 100 or 200 areas that we needed to 100 or 200 employees that we need to backfill for, and we're making those plans right now. And I think that it's important to communicate that you're making those plans so people don't think that you're going to blink or back off.
Excellent. Thank you so much, Dr. Kerouac. So I know that we are at time, and I want to make sure I'm mindful of everyone's morning today. We have some other questions that did come through. Just for the audience, we will work with Dr. Kerouac, Dr. Roos, and Attorney Kennedy to see if they're able to answer some of these offline, and then we can share that a little later with all of our registrants. But in the meantime, I am actually going to give a huge thanks once again to Dr. Kerouac, Attorney Kennedy, Dr. Roos. I'm going to invite Rick back to the floor to close us out this morning, and we will go from there. So welcome back, Rick.
Thanks, Ziamara. And again, thank you and Karen from the EDC for helping put this together. I did want to thank all the affiliates of the EDC that helped sponsor and get the word out here. Today, I certainly want to thank Dr. Roos and President Deb Bastoli from Mercy, as well as Attorney Kennedy and Attorney Parks and everybody over at Bulkley for their participation. And I particularly want to thank Mark Kerouac for really spearheading this event here today and for his personal leadership in the leadership of Bay State as we in the region combat COVID. So thank you, Mark, for your leadership. And let me just thank all of the business community. You are on this call today because you are a business of influence, you are a person of influence, and there has been a call to action that has been sent your way, which is to help our medical providers here combat and make Western Massachusetts safer, so that we can reopen our economy fully and move forward in a healthy way and in a positive economic way. And so thank you for joining here today. And I would urge you to take up the call to action that has been levied by Mark and Dr. Roos with the guidance of Attorney Kennedy. So thank you for your leadership. Thank you for your participation here today. And I wish you a safe and happy day. And here's to getting back to a vibrant economy here in Western Massachusetts.
Thank you.
Thank you.
Thank you, everyone. Have a great day.